All the assignments are made, so now what do you do? Well, you look for additional learning opportunities for the students. And it's not unusual to have a staff member suggest that they have a great opportunity for a student, and then it's your responsibility to make the determination on whether or not you want to reassign the student to take advantage of the opportunity. And I think we've talked about this a bit when we've talked about additional or alternative assignments. But keep in mind, does this opportunity support the learning objectives? Make rounds frequently on the students. Observe and review their clinical skills. Communication cannot be overemphasized. You need to know where the students are, and they need to know where you are and how to contact you. The staff nurse needs to be kept in the loop too. Who's doing what? The staff nurse needs to know what the student is responsible for and what the student will be doing and not doing relative to the patient's care. For example, if the student is a first-year student and is not capable by skill level or scope of practice to care for the IV or IV medications, then the nurse needs to know that the student will not be doing anything relative to the IV therapy or IV medications. You need to get report on the patient's progress from the student, and the student needs to give report to the nurse before they leave the floor, before they take meal breaks, and at the end of the shift. This may seem like a given, but the students don't always understand that concept yet. Students also need a formula to help them communicate, and SBAR seems to work very well, and I have a video to illustrate that in a few minutes. But first, we're going to backtrack just a bit, and I'm going to have you listen in on a conversation with Dr. Benner, where she's talking with students about the importance of their clinical instructor.